Addressing a packed room of fellow immigrants, Isabel Coronel recalled how as a retired farm worker, she never used to seek medical help because she didn't have health insurance. Right after her talk, Coronel headed to a doctor's appointment. Thanks to a law that took effect May 1, residents like Coronel, who are older than 50 and living in the country without legal immigration status, can now qualify for full medical services. It's part of a medical expansion that began in 2016 for immigrant children, and by 2024, it will cover all low-income adults and children in the state, regardless of immigration status. On January 1, 2024, California will become the first state in the nation to offer state-subsidized health insurance to all low-income immigrants residing in the country regardless of their status. This summer, Governor Gavin Newsom announced a budget deal that will expand the health insurance program to the last group of undocumented adults not currently covered, those between the ages of 26 and 49. That's more than 700,000 residents in California who don't qualify now because of their immigration status. This is a historic moment for California, reaching a goal that was nearly impossible just 7 years ago, Senator María Elena Durazo, de Los Angeles, said following the announcement of the street. Healthcare, she said, is a human right. It's the last piece of a goal that immigrant rights supporters have been pushing for years. We are who we are as a state because of the contributions of immigrants. We need to protect and defend and really value our workers who should have access to all the safety net programs, including health care, said Luz Gallegos, Executive Director of the Immigrant-Rights Advocacy TODEC Legal Center in Riverside County. TODEC recently held one in a series of workshops to educate residents about the changes and help them register for Medi-Cal, the state's version of the federal Medicaid health care program for people with limited income. That's where Coronel, a 77-year-old Perris resident and retired farm worker, shared her story. "I didn't go to doctors," Coronel said during an interview this week. "Many times, we just relied on homemade cures. Then, Coronel got COVID-19 in the early stage of the pandemic and became seriously ill. So did her daughter. Farm workers she knew died, unable to get help. In the summer of 2021, Coronel joined Gallegos and other advocates in a meeting with Newsom where they pleaded their case. She talked about community members, our workforce, giving their life to California, Gallegos said.